Hey there, fellow PsyCHNPs. Here's a practice test on DBT. Question 1. You are working with a patient diagnosed with PTSD who has frequent flashbacks as well as persistent symptoms of arousal. Which intervention should be included in the plan of care? A. Trigger flashbacks intentionally in order to help the patient learn to cope with them. B. Explain that the physical symptoms are related to the physiological state. C. Encourage repression of memories associated with traumatic events. Or D. Support numbing as a temporary way to manage intolerable feelings. The answer is B. Explain that the physical symptoms are related to the physiological state. So persons with PTSD often experiences somatic symptoms or sympathetic nervous system arousal that can be confusing and distressing. Explaining that these are the body's response to physiological trauma helps the patient understand how such symptoms are part of the illness and something that will respond to treatment. This decreases powerlessness over the symptoms and helps instill a sense of hope. It also helps the patient to understand how relaxation, breathing exercises, and imagery can be helpful in symptom reduction. The goal of treatment for PTSD is to come to terms with the event so treatment efforts would not include repression of memories or numbing. Trigger flashbacks, would increase patient distress. Question 2. 4 teenagers died in an automobile accident. 1 week later, which behavior by the parents of these teenagers most clearly demonstrates resilience? The patients who A. Visit their teenagers' graves daily, B. Return immediately to employment, C. Discuss the accident with the family only, D. Create a scholarship fund at their child's high school. The answer is D. Creates a scholarship fund at the child's high school. Resilience refers to positive adaptation or the ability to maintain or regain mental health despite adversity. Loss of a child is among the highest risk situations for maladaptive grieving. The parents who create a scholarship fund are openly expressing their feelings and memorializing their child. The other parents in the question are isolating themselves and or denying their feelings. Visiting the grave daily shows active continuing mourning, but it is not strongly indicative of resilience as the correct response. Question 3. A child drowned while swimming in a local lake 2 years ago. Which behavior indicates the child's parents have adapted to their loss? The parents A. Visit the child's grave daily, B. Maintain their child's room as the child left it 2 years ago, C. Keep a place set for the dead child at the family dinner table, or D. Throw flowers on the lake at each anniversary date of the accident. The answer is D. Throws flowers on the lake at each anniversary date of the accident. So resilience refers to positive adaptation or the ability to maintain or regain mental health despite adversity. Loss of a child is among the highest risk situations for an adjustment disorder and maladaptive grieving. The parent who throws flowers on the lake on each anniversary date of the accident are openly expressing their feelings. The other behaviors are maladaptive because of isolating themselves and or denying their feelings. After 2 years, the frequency of visiting the grave should have decreased. Question 4. A store clerk was killed during a robbery 2 weeks ago. His widow, who has a long history of schizoaffective disorder, cries spontaneously when talking about his death. Select the most therapeutic response. A. Are you taking your medications the way they are prescribed? B. This loss is harder to accept because of your mental illness. Do you think you should be hospitalized? C. I'm worried about how much you are crying. Your grief over your husband's death has gone on too long. Or D. The unexpected death of your husband is very painful. I'm glad you're able to talk about your feelings. The answer is D. The patient is expressing feelings related to the loss, and this is an expected and healthy behavior. This patient is at risk for maladaptive response because of the history of serious mental illness, but the nurse's priority intervention is to form a therapeutic alliance and support the patient's expression of feelings. Crying at 2 weeks after his death is expected and quite normal. Question 5. Which scenario demonstrates a dissociative figure? A. After being caught in extramarital affair, a man disappeared but then reappeared months later with no memory of what occurred while he was missing. B. A man is extremely anxious about his problems and sometimes experiences days, periods of several minutes passing without conscious awareness of them. Or C. A woman finds unfamiliar clothes in her closet, is recognized when she goes to new restaurants, and complains of blackouts despite not drinking. Or is it D? A woman reports that when she feels tired or stressed, it seems like her body is not real and is somehow growing smaller. The answer is A. After being caught in an extramarital affair, a man disappeared but then reappeared months later with no memory of what occurred while he was missing. The patient in dissociative fugue states relocates and lacks recall of his life before the fugue began. Often fugue states following traumatic experiences and sometimes involve assuming a new identity. Such persons at some point find themselves in their new surroundings, unable to recall who they are or how they got there. A feeling of detachment from one's body or from external reality is indication of a depersonalization disorder. Losing track of several minutes when highly anxious is not an indication of a dissociative disorder and is common in states of elevated anxiety. Finding evidence of having bought clothes or gone to restaurants without any explanation for those is suggestive of dissociative identity disorder, particularly when periods are lost in the patient, like as in blackouts. So we want to see relationship to audience response question. Question 6. You are counseling a patient with dissociative identity disorder should understand that the assessment of the highest priority is A. Risk for self-harm, B. Cognitive function, C. Memory impairment, D. Condition of self-esteem. Did you get it? The answer is A. Risk for self-harm. Assessment that relates to the patient's safety takes priority. Patients with dissociative disorder may be at risk for suicide or self-mutilation, so the nurse must be alert for the indicators of risk for self-injury. The other options are important assessments, but they rank below safety. Treatment motivation, while it is an important consideration, is not necessarily a part of the nursing assessment. Question 7. A patient states, I feel detached and weird all the time. It's as though I'm looking at my life through a cloudy window. Everything seems unreal. It really messes up things at work and at school. This scenario is most suggestive of which of the following health problems? A. Acute stress disorder. D. Dissociative amnesia. C. Depersonalization disorder. Or D. Disinhibition social engagement disorder. The answer is C. Depersonalization disorder. So depersonalization disorder, what it is it involves a persistent or reoccurrent experience of feeling detached from and outside of oneself. Although reality testing is intact, the experience causes significant impairment in social or occupational functioning and distress to the individual. Dissociative amnesia involves memory loss. Children with disinhibited social engagement disorder demonstrate no normal fear of strangers and are unusually willing to go off with strangers. Individuals with ASD experience 3 or more dissociative symptoms associated with a traumatic event, such as a subjective sense of numbing, detachment, or absence of emotional responsiveness, a reduction in awareness of surroundings, derealization, depersonalization, or dissociative amnesia. In this scenario, the patient experiences only one symptom. Question 8. A patient diagnosed with depersonalization disorder tells you, it's starting again. I feel as though I'm going to float away. Which intervention would be most appropriate at this point? A. Notify the healthcare provider of this change in the patient's behavior. B. Engage the patient in physical activities such as exercise. C. Isolate the patient until the sensation has diminished. Or D. Administer a PRN dose of anti-anxiety medication. The answer is B. Engage the patient in a physical activity such as exercise. Helping the patient apply a grounding technique such as exercise assists the patient to interrupt the dissociative process. Medication can help reduce anxiety, but does not directly interrupt the dissociative process. Isolation would only allow the sensation to overpower the patient. It is not necessary to notify the healthcare provider. When collecting family interactional data, you know to ask A. How do the actions of your family worsen your symptoms of schizophrenia? B. Since you have been in the hospital, who is taking care of your children? C. How often do you shop for nutritional items for your family? Or D. What do you buy when you shop at the local market? The answer is B. Since you've been in the hospital, who's taking care of your children? So family interactional data is probably the most complex data to obtain. It is important to determine family alliances and family supports. Information about shopping habits is not part of the interactional data, implying that the family causes or affects the client's mental illness reflects the nurse's bias. Question 10. 2 weeks ago, a soldier returned to the U.S. from active combat zone in Afghanistan. The soldier was diagnosed with PTSD. Which comment by the soldier requires your immediate attention? A. It's good to be at home. I miss my home, my family, and my friends. B. I saw my best friend get killed by a roadside bomb. I don't understand why it wasn't me. C. Sometimes I think I hear bombs exploding, but it's just the noise of traffic in my hometown. Or is it D? I want to continue my education, but I'm not sure how I will fit in with other college students. The answer is B. I saw my best friend get killed by a roadside bomb and I don't understand why it wasn't me. The correct response indicates the soldier is thinking about death and feeling survivor's guilt. These emotions may accompany suicidal ideation, which warrants the nurse's follow-up assessment. Suicide is a high-risk among military personnel diagnosed with PTSD. One distractor indicates flashbacks, common with persons with PTSD, but not solely indicative that further problems exist. The other distractors are normal emotions associated with return home and change. Question 11. A soldier returned home from active duty in a combat zone in Afghanistan and was diagnosed with PTSD. The soldier says, if there's a loud noise at night, I get under my bed because I think we're going to get bombed. What type of experience has the soldier described? A. Illusions. B. Flashbacks. C. Nightmare. Or D. Auditory hallucinations. The answer is B. Flashbacks. Flashbacks are dissociative reactions in which an individual feels or acts as if traumatic events were reoccurring. Illusions are misinterpretations of stimuli, and although the experience is similar, it's better termed a flashback because of the diagnosis of PTSD. Auditory hallucinations have no external stimuli. Nightmares commonly accompany PTSD, but this experience was stimulated by an actual environmental sound. Question 12. Which assessment finding best supports dissociative fugue? The patient states, A. I cannot recall why I'm living in this town. B. I feel as I'm living in a fuzzy dream state. C. I feel like different parts of my body are at war. D. I feel very anxious and worried about my problems. The answer is A. I cannot recall why I'm living in this town. The patient is in a fugue state, frequently relocates and assumes a new identity while not recalling previous identity or places previously inhabited. The distractors are more consistent with depersonalization disorder, generalized anxiety disorder, or dissociative identity disorder. Question 13. After major reconstructive surgery, a patient's wound dehisced. Extensive wound care was required for 6 months, causing the patient to miss work and social activities. Which pathophysiology would be expected for the patient? Dysfunction of the A. pons, B. occipital lobe, C. hippocampus, or D. hypothalamus? The answer is C. Hippocampus. This scenario presents chronic and potentially debilitating stress. If arousal continues unabated, neural changes occur that alter the neural circuitry of the prefrontal cortex, reducing the size of the hippocampus, so the memory is impaired. Question 14, last one. Relaxation techniques help patients who have experienced major traumas because they A. engage the parasympathetic nervous system, B. increase sympathetic stimulation, C. increase the metabolic rate, or D. release hormones. The answer is A. It engages in the PNS. In response to trauma, the sympathetic arousal symptoms of rapid heart rate and rapid respiration prepare the person for flight or fight responses. Afterward, the dorsal vagal response dampens the sympathetic nervous system. This is a parasympathetic response, with the heart rate and respiration slowing down and decreasing the blood pressure. Relaxation techniques promote activity of the parasympathetic nervous system. Alrighty, all done. Hope this is going to help you. Good luck on your test. Thank you.